Okay, let's dive in. We're tackling a topic today that's, well, it's one of the toughest. Suicide. It gets avoided a lot, doesn't it? Both in public and, even private talks.
It really does. It's heavy stuff, no question, but vital to discuss. And the source material we've looked at, it lays out the sheer scale.
Yeah, the numbers are stark. Thousands of lives lost every year just in the U.S.
And that's not even counting the millions, literally millions, who are living with suicidal thoughts, often silently. It touches so many.
So our deep dive today uses excerpts from a work called Breaking the Silence on Suicide. And our goal, really, is to unpack what this material tells us. Why are we so quiet about this?
And crucially, why that silence itself might be the actual danger here, which is pretty counterintuitive for a lot of people.
Exactly. That's the core idea that kind of jumped out, right? That
Mhm.
talking about it isn't the risk. The silence is the risk.
That's what the source argues, quite strongly. It challenges that whole don't mention it idea head on.
So let's get into the why. Why is this topic so taboo? According to these excerpts, what are the big reasons? It feels layered.
Oh, it is. The source points to several things. One simple one is just lack of knowledge. People genuinely don't know how to bring it up.
Right. Like, what are the words? Whether you're worried about someone or if you're the one struggling.
Yeah, there's no easy script. And that leads to fear, right? Fear of saying the wrong thing, maybe making it worse.
Mm-hmm. And what about for families who've lost someone?
There's this huge fear of judgment the source talks about, a deep, deep shame sometimes. It forces everything into whispers, which just isolates people more in their grief.
God, yeah. And if you're the one having the thoughts, what are the fears there?
Well, the material highlights fear of being seen as weak, maybe unstable, or selfish even, which is such a painful label when someone's already suffering.
And fear of the consequences of speaking up.
Definitely fear of being misunderstood, maybe being hospitalized against your will, or just getting stuck with a label, professionally, socially, that follows you.
So it's personal fears. But it sounds like the source points to bigger things too. Societal pressures.
Absolutely. It mentions cultural stigma, that whole keep it to yourself mentality, and
Yeah.
systemic issues too.
Systemic like.
The source describes it as the system basically saying, get in line, implying barriers, long waits, maybe impersonal care that just discourages people who are already in crisis.
Wow.
Oh.
Okay, so a lot of reasons people stay silent.
And then there's just the overall societal silence, where the default is nothing, avoidance.
That paints a pretty bleak picture of the barriers.
Mm-hmm.
But the material doesn't stop there, right? It brings in research findings that really challenge some of these assumptions.
It does, and this is, I think, really important. One key finding it stresses is about prevalence, how common suicidal thoughts actually are.
Okay.
It's not some rare thing. Research cited estimates, get this, over 12 million adults in the U.S. seriously considered suicide in just 1 year.
12 million.
Okay.
That number is much higher than I think most people assume. It's huge.
It really is, and it immediately raises the question, if so many people are thinking about it, why aren't more reaching out? What's stopping them?
And what does the source suggest based on the research?
It suggests it's often not because they don't want to live or don't want help. It's more that they feel they lack the permission to talk about it.
Permission. Wow. So the silence we were just talking about, it actively blocks help seeking.
Exactly. It acts as this massive barrier. And this connects to other research the source brings up, like from psychological medicine.
What did that show?
It highlighted major risk factors beyond just, say, depression. Things like feeling you're a burden on others and social disconnection, isolation.
That isolation piece feels critical.
It is. The source uses this really stark phrase, isolation kills.
Isolation kills.
Yeah.
That hits hard. And it brings us back to talking, doesn't it? Because there's that persistent fear, I know I've heard it, that talking about suicide might, plant the idea or push someone closer. What did the source say about that fear?
Okay, this is maybe one of the most vital points the material makes, citing a specific landmark study. I think it was in the Journal of Affective Disorders.
What did it find?
It found the opposite of what people fear. Having open, honest conversations about suicide does not increase suicidal behavior.
Doesn't. Really?
No, not at all. In fact, the study showed these conversations can actually reduce anxiety. They can make someone more willing to seek help.
And strengthen their connections.
Yes, strengthen social support. It reinforces that connection piece.
So the evidence points clearly. The silence is the threat. The conversation is actually protective. A lifeline, maybe.
That's the message, loud and clear from the source material. It's a fundamental shift from how we often approach this.
It really is. Okay, so if silence is the danger, what does the material suggest we do? How do we break it? What are the solutions offered?
Several things. First off, language, how we talk about it matters a lot.
Like changing committed suicide.
Exactly. Moving away from that, which sounds like a crime, to something more neutral and compassionate, like die by suicide, and reframing suicidal thoughts not as moral failures, but as part of a complex mental health struggle.
Makes sense. Language shapes how we see things. What else?
Education. Big time. The source argues basically everyone needs to learn how to talk and listen about this, not just therapists.
It's like basic literacy for everyone.
Yeah. And it points out, look, not every conversation needs to be some deep clinical intervention. Sometimes just genuinely asking someone, are you okay? And meaning it. Being willing to hear the answer. That can be huge.
That simple act of connection.
Yeah.
Showing you're there.
Right. And then there's system accountability. The source brings up a really, frankly, a shocking statistic.
Oh.
Nearly 60% of people discharged from a hospital after a suicide attempt get no follow-up care within a month. 60%.
Wait, 60? That's awful. This seems like a critical time for support.
Exactly. The source calls it an unacceptable gap, but also a fixable one. It's a clear systemic failure we need to address.
Definitely. Any other key actions?
Yeah, challenging our own assumptions about who might be at risk. The material really stresses. You can't tell just by looking.
Mm-hmm.
It mentions, the high achievers, the busy parents, the bright teenagers, even that friend who seems so strong, always checking on everyone else.
They could be fighting silent battles.
Precisely. The external image doesn't always match the internal reality. We just don't know what someone's carrying.
That's such an important reminder.
Yeah.
So, okay, if someone does open up to you, if they share that they're struggling,
Yeah.
what does the source say is the best way to respond?
It actually boils it down to something quite simple, but powerful. First and foremost, believe them.
Just believe them.
Yeah. Don't jump in trying to fix it immediately. Don't feel like you need all the answers. Just stay present. Listen without judgment. Be human with them.
That connection again.
That connection, that act of just showing up and validating their experience. The source suggests that can be the lifeline they need in that moment. It counters the isolation.
Okay, so pulling all these threads together from the source material, the main message seems crystal clear.
Yeah. What stands out most to you?
That suicide is incredibly complex, yes, but it is often preventable. And the key isn't silence, it's the opposite. Conversations save lives. Silence doesn't.
Right. The risk isn't in talking about it. The real risk lies in continuing to avoid it.
This whole deep dive, drawing on this material, it really makes you rethink things. Understanding the roots of the taboo, the actual prevalence, the danger of isolation, and critically, that research showing talking helps.
It can shift how you view the issue, right? And maybe how you interact with people around you.
Absolutely. It makes you think about your own role in either perpetuating the silence or maybe helping to break it.
And leaning into the discomfort that might come with that.
Which actually brings us to a final thought the source material leaves us with. It suggests that if this conversation, if thinking about this, makes you feel uncomfortable, that's not necessarily a bad thing.
Oh, how so?
It kind of posits that discomfort is often where change starts. It's an indicator that something important is being touched upon.
Huh. That's an interesting idea to sit with. That facing the discomfort is maybe the prerequisite for having these vital conversations.
Exactly. So maybe for you listening, reflect on that discomfort. If you felt it, what's it telling you? And how can leaning into it instead of backing away be the first step towards fostering the kind of conversations that this material argues can genuinely save lives? Definitely something to mull over.